Hi, I'm Dr. Anjana Bhana, and today we are doing some more cool aesthetic procedures. In fact, the most requested non-surgical aesthetic procedure worldwide for years and years and years. Botulinum toxin. I can't say the word, I'll say it once, Beautox. So that is a brand name, and in our country, South Africa, we're not allowed to use the brand to advertise. It's a pharmaceutical rule. So going forward, I'll use fancy euphemistic terms like anti-wrinkle injections, toxin, neuromodulators, things like that. So that's what we're going to be doing. You know, I think it's been over 30 years of using this drug. It's actually a drug. It's the world's most used drug. 100 million vials of the stuff is already being used. So it is very, very safe. But because it's a drug and this is a medical setting, before any procedure is done, a consultation is important as well as an informed consent. And in this country, in South Africa, there's two different kinds and they're not interchangeable. So how we measure it is something called units. So one is Spaywood units and one is the original Allergan unit. So today we're going to be using Allergan Beautox. And the important thing is, you know, one of the things that you shouldn't do is skimp on your botulinum toxin, on your neuromodulator. So it isn't the cheapest treatment, but it doesn't mean you should not invest in yourself, because if you don't put the right amount of units, the right dosage, it won't last very long or it won't work. And there's a new trend now called baby tox, or sprinklings of this toxin, or baby sprinkles, whatever it is. Yes, it looks nice for a little bit, but it doesn't really last. You need to put the correct amount for it to get that effect. But I'll also explain some new, well, it's not that new, but a technique called microtox to you, using the lovely Judy, who is so graciously volunteered her time and her face for educational purposes. Thank you, Judy, for being here.
Thank you for asking me.
So Judy's wearing a mask. It is during the pandemic. Our numbers are really low at the moment, thankfully, but it's a really nice procedure that you can have if you feeling you want to be ultra safe. You can have the procedure while your mask is on. So this is 100 units, and it comes in 200 units. It also comes in a tiny 50 unit vial that's nice for the upper face. And I want to just talk about, is 100 units the new norm? And if we look at, Judy, when I first started in aesthetic medicine, there was only one area that was FDA approved, and that is this area here, which is the frown, where it makes you look angry. And there are even studies that prove that doing this treatment improves your mood. So, Judy, the FDA approved amount for this area is 20 units, but people can go up to 25 units. And we're going to show you a bit later the way Judy's face moves, how you can decide how many units that you apply. And then also the forehead. So the forehead, the muscle that lifts the upper face, so that's the muscle that makes these horizontal lines. That's the only muscle that lifts the upper face. So we used to put maybe 10, 12 units, but the recent FDA approval is up to 20 units. So that's already 40 units. Around the eyes, that was the second area to get FDA approved. So before all of this, people were doing these areas. It was called off-label or academic use. It's 24 units. So between 18 and 24 units, that's already well over 50 units, and it's eating into like 60% of this vial. And then, Judy, you did something really interesting with your mouth. You're like, So that is also another common area to treat. So people do think, you know, I can treat the lower face with this botulinum toxin or toxin neuromodulator. So it's really, really interesting what you can do with it. And when you make that face, it's not about lines and wrinkles anymore. It's about feelings or attributes. So, Judy, you're like, I know you for years. You're super happy, super friendly. But as we age, we're losing volume, and this muscle's getting tight and pulling down. It's making you look sad and angry or upset. So that's what lots of people come in for. They're like, oh, I don't look so happy. And so you can actually put a couple of units here, like maybe 6 units. And as you age, your nose also tips down. Like you're not having that issue, but some people, when they smile, their nose tips down. So you can even put it in there. That's another 2 units in your chin gets really tight and wrinkly, and then yeah, so it's really tight and wrinkly, so you can put some units in there. We already almost at that 100 units. And then what I do a lot here are also masseters on your jaw. So a lot of people are under a lot of stress, especially young women, moms. I see a lot, and then they get these very square jaws, and it's not about the aesthetics. It's about waking up with a headache or grinding your teeth and then feeling that instant relief once that muscle is relaxed. And up here, there's a muscle that you can relax. And there's something, have you heard of Nefertiti? Nefertiti was an Egyptian queen, apparently beautiful, long neck, and it's called the Nefertiti lift. So there's these muscles here called platysma. They have no function. They're like your appendix. But they're pulling down your jawline, and people hate those jowls. So you can actually put up to 24 units there. What I have heard, especially personal trainers, and you get a few personal trainers, and they have that issue because they do a lot of pecs. It inserts into your clavicle, but when you flex your pecs, you can actually see them pulling down. And what they say is once it's relaxed, it's way more difficult to do abs. So you're actually doing abs from your abs and not from your neck. So that's already past the 100 units. So 100 units, is that the new norm? And not to be scared of doing the correct amount of units to get that result you want. So today we're going to do Judy's upper face because the lower face is still very cute. So we're going to do Judy's upper face. And what she's concerned about, she speaks to a lot of people. She's a rep, so she always has a mask on, and then she wants her upper face to portray trustworthiness, a relaxed, serene, happy like appearance. So that's what this can help with. So there's also something that's a bit different from baby tox or baby Beautox. I'm sorry to use the word, and it's called microtox. So it's hyperdiluting the toxin and injecting into the skin to shrink pores, reduce redness, and give you that like sort of glass skin appearance. So that also works really well. So you can do a really great combination of all the treatments. So we've just sterilized the top of this, and we're going to mix our toxin. I'm using normal saline because that's what's indicated on the package insert, and there's even studies that suggest that it lasts longer. The only thing is that it stings a little more than bacteriostatic saline. So there's a little, you see that little powder? That is the toxin. Okay. Okay, so I am just disinfecting, and I'm going to mark now. So what this treats are wrinkles in motion, muscles of facial expression. So it affects the nerves that make the muscle move. It lasts for about 3 months. And it starts to, like, once we're done with Judy, you won't see the result. It takes up to 14 days for the full result to manifest. So Judy, I'm going to ask you to raise your brows up. So Judy's got like very prominent lines, but the other thing is Judy doesn't have a huge forehead, and her big concern is the area around the eye, that it shouldn't sag. So we have to thread very lightly here. So that's why I'm going pretty high up. Just a little there. So we are definitely not going to use the 20 units on Judy. Okay, Judy, if you look cross for me. So this muscle is the corrugator. It goes through your brow, and this is something called procerus, and this makes your frown. It's pulling the upper face, down and in. So we inject in little spots here. This here is superficial. This is a superficial injection, and these are deep, almost on bone. And if you smile for me, Judy, this is called the crow's feet lathocanthus. This is a super thin muscle that runs like a circle around the eye. And not to also over-inject this, because you don't want the person to look insincere or too frozen. And if they have issues with under eye circles or tear troughs, it'll make it look worse by weakening the muscle. So I am now injecting the toxin. It sounds so scary, but it's not. It's purified, it's safe, and it's going deep into the muscle to start over 14 days to relax this area. Can you frown again for me, please? I just want to see my marking. Okay, you can relax. So this is a very superficial injection. This one's important because if it's deep in this area, it can cause a droopy lid. But we are superficial, we're in the right place for it not to do that. So the most important thing about these toxin injections is position, of course, but also depth. So these are also almost into the skin, because the muscle of the forehead is really thin. And if we go any deeper, it could track down and affect muscles it shouldn't. Okay, smile for me. Yes. Can you see? Is it fine? Mm-hmm. So we protect the eye, actually inject away from the eye. Also very superficially. This is a muscle here that goes from here to here, and it's a bit deeper, but it affects your smile. So we want to just soften the lines and not affect Judy's smile. So what this is called is intradermal, so you in the dermis. That's why it's making these little papules. You can even go right underneath here with a super low dose. So, because so many people are concerned about those lines right under their eyes, and it's very difficult to treat otherwise. Smile for me, Judy. And relax. And that's the treatment. So it is such a quick, easy treatment. I wouldn't even call it a lunchtime procedure. It would be like your tea time procedure. And you can carry on with your normal activities. Let's say avoid the sun, no saunas, no exercise today, and no touching the area, like scrunching the area. We often advise patients not to lie down for the next 4 hours, and no blow drying or doing your hair. The heat will deactivate the toxin. It's a protein, so no doing your hair today. But other than that, you're good to go safely. And these little bubbles that come up in the redness, in about 15 minutes or so, they start to disappear. So by the time you get home, no one will even know. Okay guys, I don't know why I'm so overheated. I don't know why. But thank you so much for joining me for this treatment session. So we've done our botulinum toxin. If you have any questions, comments, and make them nice comments. drop them in the little lines below the comment section. Like and subscribe, and I'd really like to hear your questions. I love answering questions. Thank you.